All right, guys, let's talk about the side effects that we can see with the prescription drug trazodone. Now, trazodone's actually an old school antidepressant, and when it was used for that purpose, it caused a lot of drowsiness. So nowadays, what you normally see it used for is people with insomnia, because it can help with sleep. Now, before we get into that, I like to explain what the drug is doing in your body because it's going to help you understand why some of these side effects may occur, or if you're experiencing side effects, knowing what it's doing in your body can help you understand if maybe that's contributing. So first and foremost, we know that it blocks the reuptake of serotonin by your body, and the end result is you see your serotonin levels go up. Okay, the other thing we see is it can block certain histamine receptors, in this case just the H1 receptor. It can also block your alpha 1 adrenergic receptor. Lots of fancy chemical talk there, but I'll bring it into layman's terms here as we go through these side effects. Now, there's two groups of side effects with trazodone. Number one, we have significant side effects. These are pretty dangerous side effects, but their chances of happening are very low. But it's important that you know about them. Next, we have a bigger group where I'll give you percentages. They're the much more common side effects, not as dangerous per se, but much more common. But let's start with the serious ones. Again, these don't happen a lot, but it's very important for you to know about them. For example, if anybody had a history of bipolar disorder, you would want to be careful because you can see activation of mania or those manic episodes, okay? We can see an increased risk of bleeding. So if you're going to go do surgery, if you're taking any medications that block platelets and affect how fast your blood clots, that's very important. Also, we can see heart issues at higher doses. We don't see a lot of high dose trazodone nowadays because of the side effect profile that I'll get to in a sec. But important for you to know that we can also see, this is a big one, orthostatic hypertension. So when you're seated or lying down and you work to a standing position, we can see this rapid drop in blood pressure. And in older folks, even younger folks, it's a fall risk. I mean, it's dangerous. Obviously, people can pass out. Next thing, and I wanted to point out, that's that alpha 1 blockade. Trazodone's blocking those receptors. That's why we have that orthostatic hypertension. Okay, then we can see serotonin syndrome. Like I said, because we have elevated levels of serotonin with trazodone, if you take it with other medications that are increasing your serotonin levels, you can run into that serotonin syndrome. An example of those medications, Prozac, Zoloft, some of the other antidepressants, the newer ones on the market, can affect serotonin levels, okay? Suicidal thinking and behavior. Primarily, this is all antidepressants, by the way. This isn't just trazodone on this one, but particularly in that younger than 24 age group, we do have an increased risk of that, so important. And then lastly, some of the serious stuff is withdrawal. You can't take trazodone long term, and we'll call long term in this case 3 to 4 weeks. Even at 3 to 4 weeks, you may need to come down slowly off that trazodone, or you can get some of the withdrawal effects. This is especially true if you've been on it long term or at higher dose. You're going to have to come off it much more slowly. Now let's talk about some of the more common things we see. Okay, maybe not as serious, but much more common. I've mentioned drowsiness a couple times. We can see drowsiness, in the ranges are because of the ranges of doses that we see, of the dosages that you can see. So 24 to 41% of people will experience drowsiness. The severity, how serious that is, it varies by person, but it's very common. It's very common to see dry mouth, 15 to 34%. Dizziness, kind of related to that orthostatic hypertension, 20 to 28% of people. Headache, 10 to 20%. Interestingly, we can see drowsiness. We can also see nervousness, 15%, blurred vision, 6 to 15%, nausea and vomiting, 10 to 13%, and then finally fatigue, 6 to 11%. So you can see that trazodone is a medication that comes with side effects that can be fairly common. You don't normally see medications with this many side effects above 10%, meaning it happens in more than 10% of people. Doesn't make Trazodone a horrible drug. It's just an older school drug, and we try to avoid using it as much as we can, but sometimes you have to, and sometimes the situation warrants it. But as you can see, side effects are somewhat common. So let me know in the comments, did you take Trazodone? What was your experience with it? It's valuable for me. It's valuable for other people that watch the video. So speaking of valuable, I hope this was, and I will see you in the next one, guys. Thank you very much.